Welcome back, everybody, to Good Things Utah. Sitting here with Dr. Patrice Hirning. She is from LDS Hospital in Internal Medicine. And this is an important segment to talk about today because the FDA just strengthened their warning on NSAIDs. Now, all of us have these in our cupboard. You may not realize what an NSAID is. Will you explain it to our viewers?
Yes. NSAIDs are non-steroidal anti-inflammatory medications. They are the medications that we think of as for pain control. Ibuprofen, brand Motrin, Naproxen, which is Aleve.
So like, okay, Advil.
Yes. Advil's
an NSAID.
Yes.
Naproxen. Celebrex is an NSAID
yes.
too. Okay.
So what would not be included in that? So we know with our cupboards, we know which ones to stay away from.
Acetaminophen or Tylenol is not an NSAID.
Okay. So there's been a warning on our labels before, right? If you look in your cupboard right now, there's a warning. What is the FDA doing strengthening that warning, and what does it mean?
So many years ago, probably more than 15, when Vioxx first came out on the market, we started to see a risk of cardiovascular events, heart attacks and strokes with that class of medications, which are called COX-2 inhibitors. They're slightly different. As we've done more work and more research, we're identifying those same risks with the other type of anti-inflammatory medications like ibuprofen, like Naproxen, like diclofenac. And so they are asking that those warnings about cardiovascular risk be added. And they still occur even with the over-the-counter brands that have lower doses. They can still cause people to have an increased risk of heart attack or stroke.
So is this something that they were always aware of, or is this something that they're just now coming to find, or?
We are finding more information. The FDA got together and had a conference in 2014 to really look at the information that was available and determined that, yes, in fact, the data is there to say it increases your risk.
Wow. Who should be worried when you hear something like this? I mean, someone that just takes it now and then for a headache or body aches, or someone that has actually had surgery?
So everyone is at risk, but that risk varies by what your personal risk is of vascular disease. So a young, healthy person, yes, has a slightly increased risk of having a heart attack from taking those, but that risk is very, very low. If you're talking about a person who's just had a heart attack, their risk is very, very high, and these medications should probably be completely avoided.
So my dad, who just had a heart attack, an open heart surgery a couple weeks ago, I'll tell him to stay away.
He should stay away.
Yeah, that's scary.
But it's particularly risky in his case in that acute time, and maybe not later. And so before you choose to take these medications, you probably should sit down with your doctor and say, what's my personal risk? What's the benefit of these medications? And what's the best way to handle this?
Dr. Hirning, I think a lot of people take these every day. I mean, I took ibuprofen over the weekend. You have a little ache or pain, and you don't think twice.
Right. I think people don't see it as risky because they are available over the counter, and you can look at them. For your average ache or pain, where you might be taking it once a week or a couple times a month, probably that risk is very low. But I think everybody should think before they automatically grab that bottle out of their medicine cabinet and take it. You know, how risky is it for me, and is this something that's safe for me?
Tylenol's not included, aspirin's not included.
Correct.
In this. Okay, if you have questions, LDS Hospital is such a great place to go for answers. LDShospital.org is the website. Also the phone number there on your screen. Dr. Hirning is in internal medicine. Thank you so much. Some great information for our viewers.
Thanks for having me.